continue our series on pain here at the University of Toledo Medical Center with Dr. Chris Brickman. We're talking about chest pain now.
Okay.
So let me ask you, if you're in something like a car accident or something around the house where you fall into something, when it comes to your chest pain, what's the best time? What are the stages people need to look at for going to a doctor?
Well, when you talk about traumatic chest pain, of course, pain itself, there's not much that happens to the chest based on trauma if you haven't hurt your lung. So really, with the issue, as we're talking about with chest pain, is have you done something to your chest that might have hurt your heart or your lung? Hurting your heart's pretty difficult to do. Hurting your lung isn't as hard.
Okay. So that would be a shortness of breath, difficulty breathing, that kind of thing?
And that's exactly what we're looking for. So if you've been in an accident, you fall, or a sports injury per se, just having pain when you take a deep breath, we don't get too excited about that. That doesn't bother us that much. It's when you're actually short of breath and you're actually resting, you're after your competition or you're not running anymore, you're not excited. If you go lay down and you still feel like you can't get your breath, that's something we probably ought to get checked out in the emergency department.
Okay, so does that mean there's significant damage to the lungs, or is it just a bruise to the chest that's affecting everything?
Well, most of the time it's really not anything. It's usually the muscles around the chest that are causing you to be short of breath. But if you truly are short of breath, you can't feel like you can get your breath, you can collapse your lung. So injuries like that, particularly for smokers and older people who are more susceptible to that, they can actually damage their lung and their lung can collapse. And we would have to do a procedure to help re-expand the lung to help it function normally.
Okay, and that's a critical thing. I mean, if your lungs are collapsing like that, that's a life or death situation, right?
Well, it can be. Most of the time it isn't. Your lung losing air is usually not a life-threatening problem. Still needs to be corrected, but it can lead to a very serious problem called a tension pneumothorax, where it actually can kink off the blood vessels going to your heart, and you could die very quickly from that. So we can never predict who's going to develop that kind of complication, so therefore these always have to be treated very promptly.
Now, would that complication ever be a genetic kind of thing, or would that always be a result of the accident or whatever happened to you?
Well, there are some genetic predispositions. We know that people with few syndromes, Marfan syndrome is one, that have more of a propensity to drop their lung, along with having some vascular problems with their heart. And there's also people who normally are just tall and thin. We know that they tend to have this lung collapse a lot more commonly than somebody that doesn't. So there are clearly certain types of body types that tend to have this happen more commonly.
And I guess with athletes, there's more of an opportunity for that kind of thing to happen, so they may be more prone to it just because of the situation they put themselves in.
And absolutely. And again, we're not only talking about the collapsed lung too. You can also bruise your lung. You could also have some bleeding that can occur, and so those things can be kind of serious as well. So those are all things that need to be checked out if you truly are short of breath along with the chest pain.
All right, we're going to continue next week. One more topic we want to get to when it comes to pain in your belly, what you need to look for. Watch for that next week. That is your Talk Back.